Before we start, I need to clarify some points that today the content is not priority. The process, on the other hand, is the essential part of learning. So process means you have to observe. So it is very difficult to take a nap or sleep during the class or chat on the line or Facebook altogether unless you can multitask very, very effectively, which I don't have any problems with that. However, because of the process of learning, we need a participation from all of you together, while the half of your groups will be presenting, the other half will be a judge. So it will take turn. So both, I think all of you will have a chance to show your friends how good you are or how bad you are. That's all right. You know, this is, I think, in my experience. Yeah, I used to be a medical student like you. I think the 5th year is the most interesting year of all the 6 years. Not including first year, which maybe is like, you know, everything seem to be excited, right? But the 5th year, because you are almost the most mature, but not yet a doctor, right? If you are in engineer, accounting, or law, you will be like working right now. But now you are student, right? Somebody call you a doctor, but you are not entitled yet. So this, remember, the last year, that you can be as stupid as you can. Because next year, the penalty is high, right? If you do something wrong, maybe there will be a backlash. So I promise you, you can do everything and you will be only a student under the umbrella of Sirat Hospital. So how good is that? Only 10 months left, right? So you may not be realizing that this is the most precious year of your life. I can guarantee you that. So we shall start to some of the topics. I believe it's not complicated, but just so you understand how we think, how should you think, and you will decide if you will be a doctor to treat this kind of problem. Yes, because doctor of medicine enable all of you to do everything from like filler injection to the nose and maybe blindness, or heart transplant if you can, right? So you will be the only one to decide which way you are going to be. Maybe one of my friends, for example, one of my friends, after finishing orthopedic training, going to be a captain in Thai Airways. Maybe, right? So who knows? You will realize later. And one of my best friends, live together in the Saraya dorm room, in Hall Prachathipattai room, and then Hall Mahitala Tibet room. 6 years together. Now he's had sex change already, and I haven't a clue. So sometimes your friend sitting together, you cannot realize that I feel very lucky. I don't have any problem with gay or lesbian at all, but declare myself, I'm still heterosexual at the moment. Okay. Now you can compare between before stitches removal and after. You can see that it will be deteriorated. Deteriorated means the scar will behave in its way from the inflammation phase in the first 2 weeks to the remodeling phase in the next 6 months, and to the stabilizing phase after around 6 months to 1 year. So if you understand this wound healing process, you can advise the patient that this will go to be some kind of inflamed and mature and stabilized. So that is the part that you understand. This is where we think the wound is already mature when there is no like capillary refill or the redness or even itching symptom associated. Understand? Oh, forgive my English. I know I don't have as good as English as one of yours, but I try. Okay, at least I give it a try. I believe one of you may study abroad before. Maybe one of your dad are foreigners. I don't know. So this is the time, as I already mentioned, you can be as silly as you can, right? Okay, so we are talking about the cause, right? This is one of the theory that we try to teach you everything, put it in one slide, and hopefully you memorize everything. Unfortunately, world doesn't work that way any longer, right? It is not a shame to pick, ouch, to pick your iPhone. I wait for iPhone 6 anyway. So it is not a shame to pick up your iPhone. Let me check. Still working. And check in front of your patient. Wait up, let me do the research. Google for a moment. Even for the last weekend, when I have the outpatient clinic in another hospital, the private one, which have a lot of foreigner, the patient asked for the gynecomastia surgery. But he said he had this quite rare disease, so-called factor V laden mutation. Anyone knows this? Okay, no problem. You don't know? You know this. Okay, explain some of this mutation problem, what it is, what it affects to gynecomastia. How abnormal? Bleeding tendency. On the other hand, it is thrombotic phenomenon. So we are not afraid of the bleeding as much because we can control the bleeder every time we do surgery. But the thing we will never know is how it will clot. It will create the so-called venous thromboembolism. This is fatal. Bleeding may be fatal, but usually we can control maybe draining, maybe re-expelling. But VTE is fatal. So factor V laden, this is the first time I have ever heard about this term. So spend about a couple minutes and we talk together. And now I think I can claim that in Thailand I am one of the experts in factor V laden. Just last 2 weeks ago. See how easy is that? So the world is working this way, but before you do that, you have to build some trust and belief in your patient first. Because if you just like this, medical student and go out, or let me check up for the dosage or for the contraindication, side effect, or anything in front of your patient, without building trust first, the result may be a bit different. So trust is something that out of topic we cannot teach you today, but you have to learn it. They call it by example, right? You have to spend some time to follow your teacher or your resident or to try to imitate, to follow their behavior, lifestyle, to how to build trust. So I think this term seems to be like abstract. It's nothing we can touch it. We call it intangible because trust building is the first step when we meet the patient and we try to get acquainted. We talk about how are you, where are you from, what are you doing, why are you here, and then the patient will give you all the complaint, their problems, social, financial, their family, and then you can do whatever you want. I mean legally, not whatever you want, legally. So I think if you cannot memorize anything, just remember this one, okay? Because the poor wound healing, usually if we drill down, we can see only 3 factors. One, infection, 2 tension, and 3 necrosis. All of these factors have etiologies. Etiologies for infection like wound condition, right? If the patient has a dog bite wound, the chance of infection may be as high as 25 to 30%. But if you have infected hernia surgery, you have a serious problem, right? So the consequence is depending most likely on the wound status, patient, or the setting, like patient with medical problems, or setting in like emergency department. For example, you do the tendon repair in emergency room OR, or you do tendon repair in the major operating room, the infection rate result is a lot different. So you have to compare all this, but it is not significant. You understand this? Infection rate depends on 2 factors. 1, wound classification, and 2, the time we spent on operation. This is the only major critical factor. Tension and necrosis is something you have to use combination of the experience plus knowledge. So these 2 don't come together. Experience, it takes time. Knowledge, maybe you can do it in just 2 minutes if you have smartphone at hand, right? So be remembering about how to treat the patient. I cannot teach you everything, but I can teach you how. So we can compare between the 2, hypertrophic scar on the left and keloid scar on the right. You cannot see a lot difference between the 2 because we define the difference by its clinical finding, right? When the patient have thick rest, but within the boundaries, this is considered hypertrophic scar and should be treated conservatively because this is around, I think, probably around 4 to 6 weeks after surgery. Maybe it began at a simple straight line. Eventually, it may become like this, right? When the scar is stable. So, hypertrophic scar, if you can diagnose, you approach it like, not invasive. However, comparing to the keloid, it is like malignant, but it's not metastasized. So we don't call this tumor or this like a cancer, because a keloid it recur all as high as 50 to 75% depending on many factors like genetics, anatomic location, and the causes of the wound. For example, the earlobe, the chest, and the shoulder are the 3 sites that is the most frequent incident for the keloid. Sometimes we can find a reason. For example, after circumcision, we think that the convenient explanation is the sebum containing inside the skin. Sebum or the smegma from the prepuce area. Usually it release and clean out every day. But if the circumcision technique entrap all the sebum, on the one hand, it makes the skin become moist and elastic because it's like oily property. But if it becomes entrapped underneath the skin, it can create an intense reaction. So keloid may recur every time. So if you know that this is the keloid from the sebum reaction, like earlobe piercing, right? This is quite common. You just remove all the tract, the earlobe piercing tract, and that should be almost curative resection. On the other hand, if it is just the keloid from the BCG vaccination, this is some kinds of the severe reaction to the BCG. So this might recur. So the etiology may be determining how we treat the patient. Can you follow me at the moment? Okay, thank you. If you cannot catch because I'm too fast, just let me know. Sometimes the scar will be viewed as a cosmetic because it is very difficult. For example, a minor scar on the body, on the chest, or on the face can be treated with reimbursement from 30 baht or from กรมบัญชีกลาง or from Social Security maybe. But it is our tax, not your tax, your mother's tax. Oh yeah, you pay tax in some kind of VAT, right? But so I pay tax. So I know I feel like an owner of all the money we spend on the budget. So you have to feel the sense of ownership in our country's budget. Every time they spend on the right scheme or on building the high-speed train, no? No? Yeah, you should, right? Because it will be your money. Not yet now, but later on. So the scar contracture can be very, very severe in terms of the function and even the life-threatening. For example, obstruction of airway, blindness, or the severe dysfunction like this and this. Usually, if you compare the health resource between countries to countries, we can divide between developed countries like Japan, US, UK, right? And not so developed, we can call developing or not so developed, not yet, almost impending, all the center. Developed country like us, you can look at neonatal mortality rate. You can look at vaccination rate. You can look at many things, but one of those is the scar contracture rate, you know? Scar contracture is a rare disease in this other half of the world. But here, because it is not only high-tech or the money we spend, but it is the social support that we lack of. Usually, the patient can survive burns. I think here in Bamrung Rat, no, sorry, in Siriraj, here in Siriraj, we have the best burn unit, critical care unit. I think we can claim it is in Asia. But we treat the patient over 80% body surface area burn can be going back home with minimal morbidities. But if you look at the patient 3 months after, they may be coming back like this. So this is the truth that we still finding a way to help patient after being discharged. So this is the critical way why the scar contracture is a main concern in the not yet developed country like us. How we treat it? There are many therapies, including mechanical, pharmaceutical, and pharmacological. What's the difference? Pharmacological. But can we use pharmaceutical? Okay, we will go back if we have some more time. For example, mechanical by having like pressure garment or massage. This is the easiest way. But you think it is easy? It's not that easy, I will tell you. This is one of my proudest moments. 18 years ago, burn patients have no way to find this compression garment. Two pair of these arm stocking cost around 6,000 to 7,000 baht per a pair. Yeah, it's just like some cheap phone, right? But 6,000 baht for some patients considered quite a high price. So that's why they have this scar contracture. So we have to fight, compete for the same money that they will spend on the chronic renal failure or in the stroke patient, just to give us some money for, 30 baht and กรมบัญชีกลาง and ประกันสังคม. For this, a little money they allocate to the burn. I think we can seek about 15 million baht out of around 12,000 million baht that we spend on 30 baht. So that's how we fight. We gather a group of patients and let them know the significance of scar contracture, which is easily prevented by just some tools and device like splint or compression garment, and eventually we succeed. So this is the story that when you treat the patient, sometimes you can treat one at a time, but if you can go for a policy design, no, what do you call, policy maker, you can change more, right? But I tried both, and I found that why we can change the world one or maybe 100 at a time. If I can be a teacher, maybe we can change the world millions of people at a time. You feel that? Can you feel that? Okay, maybe it's time you wake up because I'm going to finish this. So sometimes you can use some device or medical supplies like silicone sheet. It's very helpful, but it's still expensive, so not reimbursable. This is the next step that we have to compete for the same money. For example, they have, if you know about the Viatril, you know about this? Glucosamine. This is the money they allow to spend on OA patient for, like, you know, the OA knee, something like that. They spend at least 900 million baht a year for กรมบัญชีกลาง If I say กรมบัญชีกลาง I mean Civil Servant Medical Benefit Scheme. You understand, right? But CSMBS, กรมบัญชีกลาง so they cut it off because this almost 1 billion baht should be spent somewhere else. Silicone sheets is the same. So sometimes it is very difficult to justify what should we treat. Like now, chronic renal failure patient can receive EPO twice a week. So you think it is fair? I don't know. If you are not a chronic renal failure or you don't have a cousin with chronic renal failure, maybe not, right? So sometimes this kind of treatment is not reimbursable even from the private insurance. So this one is cheaper. It is working and it is quite effective. But it will not totally eliminate the scar, just improve the symptoms. And last but not least, surgery, reserving for those who have very difficult scar, like this, okay, or this, or no, or this, laser is another tool, or this, right? So you can compare between scar in each area, like hypopigmentation, some of the irregular surface, and hypertrophic scar. So each area may be treated differently. For example, this is best treated by IPL, intense pulse light, or some of the CO2 laser. But this area may be treated using the dermabrasion tools or laser abrasion, or even the sandpaper if you have the skill, good enough skill. But the thicker one here may be just simple excision. So it depends on many factors. How can we treat it? But remember, it may be worse. So keep in mind that the first question we always ask the patient why. Because if we know the motive, the drive, why the patient seek the health care. Because usually the patient have this scar for over 10 years, and at that moment they get to you, right? And they ask for your help. But if you don't know why, sometimes it is very, very difficult to satisfy the patient. So usually the patient have some motive that is unexplained, like change the job, to be more attractive, to attract the opposite sex. Maybe just finish or graduate from the university, something like that. So you understand this and you can deliver the best care that the patient will be happy. Any question? I spent around 30 minutes. Exactly. So you can think about this question later, but it is not nothing difficult. Now, you follow my advice in the email, everybody. Right? Right? Anybody watch Intelligence Square? Show me some hands. Naran Yelak. It's okay. Maybe next time. There's a lot of them. There are, Intelligence Square originated from Oxford University in UK. So the one I show you, it is the US chapter. There are hundreds of them. I listen to this twice a week, every day for as long as the iPhone 1. So because of the podcast, we can follow this every time we get on to the BTS or on the เรือด่วนเจ้าพระยา